Hello there, I'm Sneha Mordani and you're joining us for a conversation on COVID-19, and things are looking good. The reason why is because the government is starting the second phase of the vaccination drive from Monday onwards, which means that many more people in the country will be getting the shot against COVID-19 and will get an opportunity to get some protection from the infection, because these are the vulnerable people developing severe infection and dying of the infection. So who are these people? These are senior citizens above the age of 60 and people with underlying healthcare conditions between the age of 45 and 59. These are the two sets of people, round about 27 crore people in the country who are eligible to get the shot against COVID-19. So the good news here is that the process only gets simpler. For everybody who's been asking, the first phase of the vaccination did not allow walk-in vaccinations. This phase is going to allow walk-in vaccinations. So if you do not have a smartphone, or you are unable to log on and register in the website that has been, in fact, the URL that has been given out by the government, which is cowin.gov.in, you can then try to walk into a vaccination site. So that is possible. How will you know where to go to? First of all, the first things first, you are not required to download any new app. So there is no CoWIN app that you need to download, and that is very, very clear. What you are going to do is that you're going to go to the Arogya Setu app if you have it. So let's talk about first about those people who have the Arogya Setu app. Once you log on to the Arogya Setu app, there is going to be a tab separately for vaccinations, which is going to give out the details of the vaccination sites, your locality, the choices where you want to go to, which hospitals are private, which hospitals are government, and you can choose your timing, your date, your hospital, and go and get the shot. To make it clear, you have to pay an amount in a private hospital, not decided by the government just yet. In fact, right now as we are speaking, that conversation is undergoing between Dr. V.K. Paul and representatives of Serum Institute of India and Bharat Biotech to develop, that is of course, these are the two companies developing the vaccines, to decide the pricing of the vaccine, for which the private hospitals will be getting it from the government. That is getting discussed. In a private hospital, how much do you really have to pay? The sense is right now that the government is going to be paying for the vaccine. So the government is going to be paying the private hospitals will be getting it from the government. What you really have to pay for is the service to get the shot. So how much you have to shell out is going to be nominal, that fee. So if you do not have the Arogya Setu app, what do you do then? Then you go into your smartphone and you log on to the website, which is cowin.gov.in, which is cowin.gov.in, and then try and register yourself. But here's the catch. If you do not have a smartphone, you cannot browse in any other phone. Obviously, you have to have a smartphone for it, or you have to use a smartphone of your neighbor or a friend, says the government. Use that for registration, but put in your number. So when the SMS comes for your vaccination as a reminder, the message is going to come in your phone and not your neighbor's phone. So we've just tried to simplify the process on how to go about vaccinations and registrations to begin with. Also, in rural areas, the Gram Panchayat is going to be actively involved in this. The Gram Panchayat, of course, has identified vaccination sites, and it's here where rural folk will go in and will be helped in doing their registrations. What do you require to register? You require your Aadhaar number. You don't even require to produce your card, because this is a digitally saved identity proof. So you need your Aadhaar identity number. If you do not have that, no problem. You can go in with a photo identity card of the government, an electoral card or a PAN card, but you have to take the copy, because then there is going to be a photocopy of which the government is going to keep with itself to manage your data, manage your records. So this has to be kept in mind. You have to have this. Now, what about the people who have underlying healthcare conditions? What if you go to a vaccination site, say a government vaccination site, and you don't have anything to show that you are diabetic, for example? 20 comorbid conditions have been identified, by the way, by the government to detect or to understand, to choose you as that category of people, within that category of people who are comorbid. So 20 diseases, even if you have one of those 20 diseases, you are considered eligible to get the shot. If you go to a government vaccination site, that is free of cost. And how it's going to work in a private hospital, I just spelled it out. You go to your medical practitioner first. If you have any underlying healthcare condition, hypertension, if you are a heart patient, if you're diabetic, the list is there. Then you tell your doctor to write down and certify this. And you produce that certificate when you go for your shot, whether it's to a government site or whether it's to a private hospital. You produce that certificate and you get eligible for your shot. The process is the same when it comes to the other things. For example, the first SMS, a reminder message that's going to come to you. If your shot is on Tuesday, you'll get a reminder on Monday, one day before. After 28 days, you'll be sent a message that your second dose is due one day before. So that's a reminder again for you. So these are things that you need to know, because if you are eligible from the 1st of March onwards, the government also intends to vaccinate as many people as it can. Right now, these vaccines are in the clinic, one of them is has got emergency use authorization in the clinical trial mode. That's also something that you should be aware of. The other one is, of course, has got emergency use authorization, which is restricted use. That is Covishield. But you have to continue to track yourself to see if you're feeling okay after the vaccination. Go back to the hospital if you are not feeling okay. That's what you need to do. Before that, when you take the vaccine, 30 minutes you have to wait at the vaccination site. So that doesn't change. That process essentially doesn't change once you get the shot, to monitor adverse events or even serious adverse events. Apart from that, there are many questions that have been asked by the government. What are the problems that you can expect? One of the problems that you would see, and that's perhaps expected, is that there will be speed issues when you log on to the website and when you try to get this done online, because there will be a lot of people trying to do it, so you might get stuck somewhere. That's a problem. But registrations are encouraged, is what the government is saying, because if you do a walk-in, your chance will obviously come after the person who's done the registration. It's like any other doctor visit. Those who have the appointment get the priority. Those who do not have the appointment and do a walk-in sort of a visit have to wait. So it's the same for this as well. It doesn't really change. Other things that you can expect is that there could be some delay also, and apart from that, if you have questions like, what if I do not make it to the appointment, you can reschedule it. So that's again an option before everyone, for this to be rescheduled. So the government has all in all tried to make the process a little more simple, given the fact that there's been criticism that the pace of vaccinations essentially is slow in the country, and what should be done to improve that. And for this reason, the government is trying to walk that extra mile by introducing walk-in vaccinations. The government says all this while we were trying to get the people into the vaccination site, now we expect the demand to go up. Now that many people are actually wanting and waiting for vaccinations, that is something that should happen. Thank you for joining in.